Hello friends, I am Dr. Puneet Aggarwal, consultant physician at Sohana Hospital, Sector 77, Mohali. I will be talking upon latest updates in hypertension. That is, what are the latest recommendations in controlling high blood pressure? As per WHO, nearly 63% of total deaths in India are due to non-communicable diseases like diabetes, hypertension, cancer, stroke, or heart attacks, out of which 27% are attributed to heart diseases, which affects 45% of people in the age group of 40 to 69. In India, the prevalence of hypertension is going up and up. It has increased over 30 years to 38% in men and 32% in women. Earlier, it was 29% in men and 28% in women. Despite that, nearly half of the people, that is 51% of the male and 41% of the female patients, are even unaware of the condition. And those who are aware, even those patients are not taking the medications regularly. So there is a lot of uncontrolled hypertension seen in the public as per Indian data. International Society of Hypertension has released 2020 global guidelines. Also, American Heart Association and American College of Cardiology has revised the guidelines in 2021, offering a new guidance for management of stage 1 hypertension. Stage 1 hypertension is when the blood pressure is upper blood pressure is up till 139 and lower blood pressure is in the range of 80 to 89. The recent guidelines says that in the stage 1 hypertension, it should be first starting with the non-pharmacological therapy. The medication should not be started in this range. And if the blood pressure is not under control after 3 to 6 months of lifestyle modification, then only we should start with the medication therapy in the stage 1 hypertension. But if someone is coming with the stage 2 or stage 3 hypertension at the presentation, medications should be started on the first visit also. Lowering blood pressure to our lower limits in the normal range is very important. It has been seen that the lowering blood pressure, systolic blood pressure target to 110 to less than 130 is helpful in reduction of cardiovascular adverse events. It is also very important that ambulatory blood pressure should be checked. Only the stat blood pressure reading at the office is not sufficient to manage hypertension. Diagnosis of hypertension should not only be dependent on the office BP reading, but also 24-hour BP reading. Nighttime BP readings are very important because these are more crucial and their control is related with a better cardiovascular outcome achievements. For every 20 or 10 millimeter mercury of increase in BP measured at night leads to high mortality risk by 23% and high risk of cardiovascular diseases by 36%. It is also advisable in the recent guidelines that patients should be started with the combination treatment. If you are giving two drugs at different times of a different class, patients generally have a poor adherence and they used to skip the medication. So if you start with the combination therapy and you give a single pill of a combination therapy, it is better and patients will be taking it once in a day and it will be helpful because it will reduce the pill burden. Also, it will help in the better patient adherence. So fixed drug combinations are generally given. And it has also been studied that the nighttime therapy as compared to the daytime therapy is more helpful in controlling hypertension and as well as it has a favorable cardiovascular risk reduction. So these are all the recent updates on hypertension. Whenever in doubts, you can talk to your physician or you can come to us to guide you. Thank you so much.